Good afternoon, everyone, and welcome to today's webinar, sponsored by Workday. I am Brian Zimmerman, the Custom Content Editor at Becker's Healthcare. For the next hour, I will be your moderator, leading a discussion on why more intelligent cloud ERP is a game changer for children's hospitals, with Spencer Cowell, Vice President of Financial Strategy at Children's Hospital of Philadelphia, and Robert Shoemaker, Executive Director of Finance for Dayton Children's Hospital. I will begin today's webinar with a brief overview of some of the healthcare industry trends most affecting children's hospitals today. Spencer and Rob will then answer several prepared questions on the touched upon points. Near the end of the hour, we will take audience questions. You can submit any questions you have throughout the webinar by typing them into your control panel in a space labeled Enter a Question for Staff and clicking Send. We look forward to hearing your questions. About a week following the webinar, you will receive a copy of the presentation to the email you used to register. At this time, it is my pleasure to get us started with a brief dive into industry trends. I'll begin with partnerships. Pediatric hospitals have developed prestigious reputations for delivering high-quality care for complex medical conditions with optimal outcomes. However, prestige does not make these entities immune from growing competition. While smaller hospitals may be cutting pediatric services, many major health systems are expanding their pediatric offerings in hopes of bringing in more patients and expanding their ability to deliver integrated services across the continuum of care. In this environment, many children's hospitals are entering into partnerships with large health systems to improve efficiency and mitigate competition. In addition to increased competition and a potential winnowing of the patient pool, children's hospitals that remain independent may be faced with competition in the recruitment and retention of pediatric specialists. Cost reduction. Amid declining government reimbursements and uncertainty around state budgets, leaders of children's hospitals are under substantial pressure to identify cost reduction opportunities. Solutions designed to improve administrative and workforce efficiency, as well as optimize the supply chain, can yield significant declines in cost. Researchers from Navigant found hospitals could slash their supply chain budgets nearly 18% by improving process efficiency and product utilization. Opportunities for improvement include enhanced purchasing compliance, product standardization, and better management of inventory. With regards to workforce management, children's hospitals have the opportunity to capitalize on technology advancements designed to improve staff efficiency. Controlling waste. Children's hospitals are uniquely susceptible to issues related to supply chain waste, simply due to the varying ages of their patients, who range from premature infants to teenagers. To accommodate such a broad range of patients, children's hospitals must stock various doses of medication and many different sizes of equipment or tools. Managing medication doses can result in substantial waste due to variances in supplier packaging. Data-driven decision-making. Data, analytics, and technology play an increasingly important role in hospital supply chain, workforce and financial strategy, as well as patient care. The speed and efficiency at which this information can be accessed is crucial. Legacy ERP solutions often rely on a mix of tools and solutions that can often create data silos. Providing administrators and staff with data in real time is becoming increasingly essential to performance optimization. Adding a cloud-based enterprise resource planning ERP solutions to health IT infrastructure is one way these organizations can reduce costs by improving labor efficiency and eliminating supply chain waste. To summarize, many major health systems are expanding their pediatric offerings in hopes of bringing in more patients, creating competition for standalone children's hospitals. Amid declining government reimbursements and uncertainty around state budgets, leaders of children's hospitals are under substantial pressure to identify cost reduction opportunities. Children's hospitals are uniquely susceptible to issues related to supply chain waste. Data and analytics and technology play an increasingly important role in hospital supply chain, workforce, and financial strategy. With these trends in mind, I will hand over the floor to our guest panelists, who will share a little more about their organizations and their experiences on the ground. Spencer, can you get us started by telling us a little bit about yourself and your organization?
Sure. Thanks, Brian, and good afternoon to the participants on the call. I'm very excited to spend a little time with you and Rob Shoemaker today to talk about our experiences with ERP. Briefly, a little bit about my background. I'm Spencer Collin, the Vice President of Financial Strategy here at the Children's Hospital of Philadelphia, where I have been for close to 2 years. And prior to my time at CHOP, I was the Regional CFO and Analytics VP at Presence Health in Chicago for 5 years, and before that was a Finance Director at the University of California, San Francisco, and started my career really at Ernst & Young in their healthcare consulting practice. So when I was leaving Presence Health in Chicago, a colleague of mine said that that I was the only person he knew that had tri-coastal healthcare experience. So I've had the honor to work in some really great organizations, and in each organization I participated either in an EMR implementation, an ERP implementation, or both. I also just wanted to give a little bit of background about CHOP. CHOP was founded in 1855 as the nation's first pediatric care hospital. Its inpatient services operate today on one campus, although we have made announcements to build a second campus in King of Prussia. Our main campus today has 560 beds, and our occupancy rate is just over 90%. Our enterprise, our ambulatory visits are about 1.3 million a year in 50 sites, including specialty care centers, urgent care centers, and primary care. Our operating revenue is $2.9 billion annually. CHOP was the first pediatric hospital in Pennsylvania to receive magnet status in 2004, and it's been twice certified. Our hospital serves regionally in Pennsylvania, New Jersey, New York, Delaware, and Maryland, but also pulls patients from across the country and internationally. CHOP's the exclusive pediatric teaching hospital to the University of Pennsylvania School of Medicine with over 1,400 medical staff. Our organization includes one of the world's largest pediatric research facilities with about $400 million in expenses, as one of the top 3 pediatric research centers in the nation for NIH grants. CHOP is involved in some really interesting, groundbreaking research. Recently, as reported in the Wall Street Journal and the Atlantic, an artificial placenta system. The research team working on this project has successfully gestated premature lambs in an artificial womb, and our intent is to bring that technology to humans next. So it's kind of there's a lot of interesting research going on at CHOP. I also want to let you know where we are on our ERP journey. So we initiated what we have branded as the Galileo program last summer. This includes the Workday implementation for finance, HR, and supply chain. We also are implementing Strata for planning and eCoupa for e-procurement as part of that program. Our Workday implementation started in January of this year, and we have an enterprise go live of 7/1/19 about a year from now for all the Workday modules that we purchased. So it just gives you a little background on kind of where we are on our journey.
Thank you, Spencer. Rob, similar to CHOP, your organization also implemented new cloud ERP. What drove this initiative for your organization? And could you give us a little bit of background about yourself and your organization?
Sure, happy to. My name is Rob Shoemaker. Thank you for having me. I am the Executive Director of Finance at Dayton Children's Hospital. I currently have responsibility for general accounting, payroll, accounts payable, capital and operating budget, financial reporting and long planning, and enterprise analytics decision support. I've been with the organization for just over 18 months and previously worked in an adult system in Cincinnati for 9 years. Previous to that, I also happened to work in public accounting at Ernst & Young, similar to Spencer. Dayton Children's is the region's only medical facility dedicated solely to children. On our main campus, we have 178 beds. We care for more than 300,000 children across 20 counties in Ohio and eastern Indiana. Dayton Children's is also a magnet hospital and is home to the Department of Pediatrics at Wright State University's School of Medicine. And together with the United States Air Force, we share the nation's only civilian military integrated pediatric training program. We have approximately 3,400 employees and 140 employed physicians. We recently opened up a new patient tower on our main campus. And in addition to our ambulatory expansion in the community, we are undergoing construction of a new Center for Community Health and Advocacy to serve our more vulnerable patients, including foster care and care for children with medical complexities. We are also about to open up a mental health crisis unit, and we'll be opening up an inpatient mental health unit next year. Similar to CHOP, we are actually implementing Strata as well right now. As mentioned, we went live with Workday on 1/1 of 18, so we're about 6 months in. Our major driver in implementing a new ERP was that our key HR and payroll system was scheduled to sunset in March of 2018. Our original plan called just for replacing those two systems, but we quickly determined that we needed a full ERP solution. Besides the sunsetting of the legacy system, other key drivers that just drove our decision to expand the initial proposal were the desire to integrate all of our HR, payroll, financial, and supply chain systems. As an organization, we had many disparate systems across our network. Many of them did not talk and integrate with each other. This change was a great opportunity for the organization to keep pace with the growing complexities of HR and financial functions and eliminate many manual processes that had been in place for years. As an organization, our goal was to move forward and eliminate silos and workarounds. As with many institutions, the path of least resistance is often taken. Because many of our systems had been in place for so many years, workarounds were pretty commonplace. Oftentimes, this led to less accurate information. Our goal was through these workarounds that we were able to make better decisions with better data. From an ERP perspective, our focus was to ensure that we would be able to make great strides in our business processes. We also desired an ERP that allowed us to dynamically change those business processes as our organization changed. We also wanted a user-driven approach and a focus on employee and manager self-service. As an example, we wanted to eliminate paper forms and electronic forms for expense reimbursement. We did not want our managers going into multiple systems to hire or replace FTEs. We wanted to provide a better overall HR and finance experience for our employees. This also included providing mobile access for various functions.
Great. A lot of combined expertise on this panel. Let's go ahead and dive into the prepared questions. Spencer, I'm sure there's no shortage of strategic initiatives across your organization. Why did cloud ERP become a top priority?
So about 3 years ago, CHOP was at a crossroads with its current ERP vendor. We faced a rather large on-premises upgrade, and it created an opportunity for us to consider kind of what our critical factors in moving forward would be. We identified 7 in a new ERP system. First, we knew that our current chart of account structure was in need of an overhaul. We had created over 20 years of work on our general ledger, and what we really would define as a thick GL. We have over 4,000, since we haven't implemented Workday yet, we have over 4,000 cost centers and thousands of accounts. Our GL structure really is used for different reporting needs in different areas of the organization with little consistency and structure that was difficult to maintain. So we knew we needed to fundamentally change our chart of accounts, which really required either a reinstallation of our current vendor ERP or selection of a new one. Second, we felt strongly that we needed to find better ways to leverage our ERP system to drive savings. And primarily that savings that we've identified through our kind of evaluation process is in supply chain. Third, we acknowledge the need to standardize, streamline, and simplify business processes and how we are organized to provide what we call our enterprise business services. So right now there's a good deal of variation in our business processes, and we had hoped our next generation ERP would help us promote leading practices around our business processes. Fourth, there was a strong desire to embrace management reporting capabilities. This was identified as a gap in our organization, and we wanted to focus on reporting tools that were timely, consistent, and dependable. Fifth, we needed transparency in cost and operational data. So at CHOP, we often talk about a desire to be able to evaluate our services from the research bench to the bedside. Our current system allowed for vertical reporting, but when we needed to look across the continuum, it was required data extraction and manipulation if we wanted to do that. Six, we needed our ERP to support sustained behavioral change. So over the course of the many years that we've had our ERP system, we've had a significant amount of customization on our on-premises system. And that was challenging. So one of the benefits of Workday is that they really provide guardrails by focusing on configuration, but not customization. And finally, and I think Rob mentioned this, improved user experience. Our current system really was not hitting the mark, and we knew we needed to find a vendor that highlighted the end user experience.
Great. Rob, we talked earlier about some of the challenges facing children's hospitals. Now that you're live, how have you gained more insight to address some of these challenges?
Sure. I'll actually piggyback off of one of Spencer's comments about reporting. As I mentioned earlier, our goal was to get better, more accurate, timelier information. Workday's reporting functionality has been one of the biggest wins since we went live. Previously, we would often find ourselves dumping data in Excel and combining it from various sources. I'm sure Spencer does that as well. Workday's reporting allows us to build custom reports and get real-time information and push that out to managers and directors across the organizations. And we've made great strides so far in the reporting in Workday, but I believe we haven't even come close to the potential. We are now able to internally build those custom reports and ad hoc reports. They can be used by HR or finance and soon to be supply chain, or they can be pushed out distinct groups of managers and directors, and all that's limited by distinct access and security. Workday has also allowed us to be more accurate with our information. By creating work tags and cleaning up our general ledger, we were also able to create more accurate and effective reports to meet the needs of our leadership. The drill down capabilities in Workday are also much better and create a better end user experience for our managers and directors. Even tracking key initiatives across the organization no longer requires us to manually create reports or dashboards in Excel or any other third-party products. We can now push out those key initiatives directly to those responsible for managing them.
Spencer, why are children's hospitals uniquely positioned to benefit from rethinking their business systems?
Yeah, in many ways, I would say that children's hospitals and adult hospitals have more in common than that are different. But some of those goals I mentioned earlier, I think could certainly apply in the adult space, and that's where I've spent most of my career. But I would say that there are a few unique characteristics about children's hospitals, and so I'll propose a couple. One is most children's hospitals in the country are fairly self-contained. We haven't gone through significant hospital merger and acquisition activity, but rather through organic market share growth in the communities we serve, which means that our culture in our organizations and mission is fairly well established. We often don't have hospitals in multiple states, and we historically don't have multiple ERP systems in place. So our environment is more contained, and therefore, when we go to implement a new ERP, I think we might have a better opportunity to more quickly adapt to that new ERP environment and structure, and more quickly see the improvements in business services that we can provide. Another reason we may be uniquely positioned to benefit from this work, and I think we've talked about this a little bit today, is supply chain and the high level of complexity of our supply chain in children's hospitals. So Children's hospitals typically have a wider variety of medical supply products, which Brian mentioned in the beginning, with a wider variety of sizes, which can benefit from improved inventory management and procurement. As an example, we have products that vary by 1 pound increments for babies having surgery. So ensuring we have the right level of inventory for the vast number of supplies is critical for a children's hospital. We also have at SHOP significant custom manufactured product demand. We need excellent supply chain infrastructure to ensure we can quickly fill these needs. An example of that is last year at SHOP, medical team separated 10-month-old conjoined twins who were joined at the top of the head. Our medical team needed custom manufactured models of the twins to plan the surgery. We were able to secure the supplies, but it took a great deal of personal supply chain intervention to make this happen. A new ERP system with enhanced sourcing and inventory management capabilities would only improve our ability to support our medical teams and our researchers quicker with less manual intervention and at a lower price point. So those are a couple of examples, I think, of some things that might be a little bit unique from a children's hospital perspective.
Thank you. And Rob, as vendors and technology companies continue to flood the market with new IT, apps, bolt-on solutions, etc., it can be difficult for children's hospital leaders to know which solutions are the best fit for them. How did your organization approach considering new ERP solutions? How did you know it was the right time?
Our initial due diligence started in January of 2016, and as I mentioned, we originally included just requests for payroll and HR. That was due to those two systems sunsetting in March of 2018. During our discovery phase, we quickly pivoted our focus to include a full ERP product. Our internal stakeholders framed out 3 specific principles that would lead our RFP process. The 3 main criteria were that it had a strong healthcare niche, provide a full ERP that would be updated and advanced with regularity, and be cloud specific with mobile technology. During that process, we narrowed our choices down to 4 products. Utilizing a formal RFP process, we engaged an outside consultant to consult with us on our selection. We had certain requirements that had to be met, and we did extensive product research. Additionally, we had multiple product demos and reference checks. We performed deep dives into functional areas, specifically IT, HR, and finance. In the end, we selected Workday for a variety of reasons. First was its ease of use. Workday is a very dynamic platform and can be designed to fit the needs of the organization, ensure best practices are in place for business processes and security. Workday is also a unified system that allows us to provide a better user experience by utilizing manager self-service and a custom platform across various user needs. Managers are now able to go to one web link to put a job rec, submit expenses, review their own pay stubs, and review their budget to actuals. Workday has also stood apart because it was built for the cloud. It provides great mobile access and was built from one unified code and not retrofitted. From an implementation standpoint, the design and discovery phase of our implementation began in June of 2017. Our system testing took place 3 months later in September and October, and we moved into production in December. All of our employees gained access to the system in late December for data validation. All systems went live on 1/1/18.
Great. So Spencer, your organization's ERP implementation is focused on HR, finance, and supply chain. How did you manage the evaluation and decision to move to a new ERP across these key areas of operations?
For our project, it really has been a collaborative effort across all of these areas to find a solution that promised to meet our needs. From the beginning, we went in believing this was going to be an enterprise solution. We were pretty clear on the scope, and we were also pretty clear that this was not a finance solution, a standalone finance solution, or standalone HR supply chain. And in fact, it required some faith on the part of our team members that we would deliver an enterprise solution, but one that also met their specific needs. We also developed the right level of governance infrastructure to support our efforts. We had strong executive sponsorship from the onset, and we made what we now have branded the Galileo program at CHOP, a CHOP enterprise goal, which helps to elevate the priority of our work. Our selection process was extremely comprehensive and thoughtful. It began at the end of 2016 and completed in July of 2017 for our Workday contract. For our ERP selection, we had, similar to Rob, we had on-site week-long demos for 3 of the 4 ERP vendors in our evaluation. We had a series of reference checks for each of the domains. And at the end of the process, we actually did site visits to Workday and 1 other finalist to get a better sense of the partnership that we would have with either firm that we were going to work with. At the end of the day, we were looking for that ERP vendor to be a partner with us, and the one that offered the best opportunity to provide an enterprise solution for our organization. You know, it's interesting and a testament to our team how much they focused on the greater good in this process. For instance, supply chain review of Workday indicated at the time fairly limited capabilities in the version that we were reviewing of the product. So you would have thought that our supply chain team would have recommended another vendor, but at the end of the day, our supply chain team saw the potential for partnership with Workday and bought into the roadmap that they had presented. And supply chain also saw the strengths of being part of the same system with finance and HR, and ultimately they selected the Workday product. So I think that was really a testament to our team here at CHOP that did the selection and now is continuing to work on the implementation, that we've really kind of taken an enterprise approach to our work.
Rob, it's no secret margins are shrinking for hospitals nationwide. In this current economic moment, why is it more important than ever for hospital finance leaders to focus on the supply chain?
We actually just kicked off our Workday supply chain implementation this week, and our plan is to go live on 4/1/19. So this is hugely important and very in the strategic focus of our organization right now. With many changes coming, like bundle payments, risk sharing with payers, and incentive for physicians, we need to make sure that our supply chain is a strategic and forward-looking department that looks to be innovative with pricing. While pediatrics sometimes can be a little bit behind adult systems, we do know that we have our challenges that the adult systems do not, as Spencer mentioned. And some of these other challenges, like bundle payments and risk sharing, aren't necessarily in pediatrics right now, but they're coming. We need to make sure that we're ready to adapt. In order to be ready, we need data and we need to know our business. We need to engage our clinicians on variation, waste, and utilization. In order to do that, we need our supply chain to expand beyond traditional procurement logistics and focus on value-based care and align supplier contracts accordingly. With data being key to all of this, accuracy is of paramount importance. We need supply chain to partner with decision support and data analytics to ensure accuracy as we analyze detailed and total cost per procedure. We believe with that, when we are finished with our Workday implementation of supply chain, we will have access to real-time data that will drive our business decisions with vendors and clinicians. More than ever, we need to be proactive instead of reactive with our costs. Innovation and alignment are the keys, whether it is looking for new supply channels, such as smaller companies, or adding supply chain talent from non-healthcare sources. We must continue to think outside the box and fine-tune our best practices.
So Spencer, I have a similar question for you. As a finance leader, how much of your time is focused on operations, specifically the supply chain? How can finance leaders at organizations with suboptimal supply chain costs increase their influence in this crucial area of operations?
And for us, this all starts with close collaboration between finance and our supply chain leadership teams. We are spending more and more time, I would say, on our collaboration moving forward just through this project. Our system selections, once fully implemented, we believe will be a competitive advantage for us in the children's healthcare market. We've also developed a large financial process improvement program over the past year at SHOP, which we call financial stewardship. We have organized the work into 4 domains, which are lead, improve, grow, and perform. And we believe the Workday implementation will support each of these domains in one capacity or another. As an example, in the improve domain, we have a goal of identifying and implementing $120 million in financial improvements over the next 3 years. So a significant component of this work is focused on supply chain improvement. We believe having the right technology, a best practice service delivery model, and streamlined business processes are all foundational enablers to support our financial stewardship program. So having all these components together can really move the needle on supply chain performance.
Thank you. Rob, today's technologies can serve as a catalyst for change to legacy processes. How is your team rethinking past processes to get the changes you need in HR, finance, and supply chain?
This is a great question. Change management has been such a huge part of our organization over the past 2 years. When we chose Workday and began the implementation of our HR and finance functions, we took an approach of not trying to fit our past practices into Workday, but instead reevaluating all of what we do. Our goal is to come out with business processes that are best practice and align with the goals of the organization. Our HR team has probably gone through the most change that has trickled across the organization. They've done an excellent job of managing that change through communication and training. They went from multiple systems to one system, and probably the biggest change of all was implementing manager and user self-service, which has been a great step forward for us. Finance was also able to completely redefine roles and business processes. Since implementation, many of our staff have very different job duties than they did before. We are now able to be less clerical and more thoughtful with what we do on a day-to-day basis. We've eliminated many manual processes, so now we've opened up time to do more analysis. Workday has also allowed us to be less siloed, not only in departments, but as an organization. Because of how Workday functions with business processes and security roles, our teams in finance and across the organization need to talk and communicate more than ever. At the end of the day, this has led us to better and more accurate information by questioning past practices. Lastly, we took our Workday implementation as an opportunity to clean up a lot of our legacy data. As Spencer mentioned with his GL, we had the same thing, and as we kicked off our supply chain implementation, we're seeing it as well. We took the opportunity to clean up our vendor list, our chart of accounts, a lot of our HR data. And we had a principle that we were not going to bring any bad data into Workday. So it was a lot of legwork, but it was cleaning up that legacy data was very important.
So lastly, I'll invite each of you to answer this question. What is the most important healthcare trend influencing your end-to-end business operations that hospital finance leaders should keep an eye on in the next few years? Rob, we can go ahead and start with you.
There's so many challenges that we are all currently facing, whether it be adult systems or pediatric. Rising costs, technology, the shift from volume to value-based care, just to name a few. For us, I think the challenge around revenue cycle are the ones we need to keep our eye on. The continuous changing dynamic of health plans make it harder every year for patients and families to understand their financial responsibilities. While uncompensated care and bad debt continue to stress performance, we need to have an open dialogue with our payers to ensure that patients get the best care possible, and it must be in an efficient and transparent manner. This holds especially true in pediatrics, as our customer preferences have continued to change. Parents today expect easy and convenient access for their children. They also want text and not phone calls. As provider institutions, we need to make sure that we continue to adapt to the consumers we serve.
Thanks for those insights. Spencer, what's your take?
When we talk with our board about our long-range financial plan and our down scenarios, they typically revolve around 4 main themes. The first is third-party payment reimbursement. from the government for participation in Medicaid, CHIP, and graduate medical education. The second is payer mix shifts. Third is unanticipated expense inflation from high-cost drugs, supplies, and other factors. And the fourth is growth assumptions going forward. Our Workday implementation certainly can help with mitigating the risk of expense inflation. But I'm focusing, in addition to that, on leveraging the analytic capabilities of Workday long-term to transform data across the organization into information that helps us make good strategic decisions around growth. Many children's hospitals come from a position of a strong balance sheet. About half of the children's hospitals that belong to the Children's Hospital Association have a rating of AA, which is a real advantage, but investing in the right capital projects, the right business plans, and the most beneficial research opportunities are really key for CHOP. We're talking a lot at CHOP about how we can leverage Workday to be a game changer and how we make those strategic investment decisions.
Thank you, Spencer and Rob, for that informative discussion. We will now begin today's audience question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for. We'll start with this one. How does your mission impact your priorities for investing in and using technology? How do you communicate and engage with employees? How technology frees up more time to spend with kids? Spencer, you want to start with this one?
Sure. At CHOP, we've spent a good bit of our capital from an IT standpoint over the last decade or so on our EMR capabilities. There's been significant investments. We're an Epic shop. And as I mentioned in my statements previously, we have not had a new ERP since 1999. It was actually a Y2K project at the time. But so now we do believe that this is going to be, as I mentioned, a game changer and a competitive advantage for us to make this investment. And one of the things that we really want to focus on is that I certainly am looking forward to the analytics, the benefits of the analytics that are going to come out of the system, even how we operate in finance, how efficiently we operate in finance, moving from a thick GL to a thin GL. But what we don't want to lose sight of is how we're minimizing the administrative work of our staff and making that easier for them so they really can spend more time taking care of patients, and children, which is our mission. So that's kind of where we are, is what we wanted. When we talk about this throughout the organization, we do see the benefits on the analytics side, absolutely, but we also see a lot of advantages to so many users out there that are using our systems for HR, for finance and supply chain, and are spending unnecessary amount of time on all these administrative tasks, and we want to make sure that we can improve on that.
Rob, did you want to add anything to that? I'll just echo Spencer's comment. You have a finite amount of capital you're going to spend, and ERP is obviously one of the biggest investments you can make, and you don't want to do it very often. So I think choosing the right one and leveraging it to free up your staff and your clinicians' time for patient care and not clerical tasks is definitely a value add.
Thanks for that. And so we've got a bunch of good questions coming in. We'll go with this one. How did you think about the implications of big data analytics and AI capabilities on your investment in a cloud ERP system? Rob, we can start with you this time if you'd like.
Sure. We came from various systems, and bringing all our data into one system, say the EMR, obviously was a great advantage to us. We're only 6 months past our implementation, And we're already seeing much better, cleaner data, and our end users are able to see that data more clearly and ask questions. And we've already seen a lot of change throughout our budget process and things like that as questions get answered.
Spencer, you have something to add?
Yeah, well, here at CHOP we have what we call the CHOP Data Warehouse, and it's actually we've made significant investments in that and kind of our analytics platform. And we do a lot of research here at CHOP. So you know, we haven't implemented yet, but we're in that process. But there's a lot of discussions going on around you know, what data and how the data will go into the CHOP Data Warehouse, how we will use it. So I think we're a little early on that process on the AI side. One interesting thing that Workday has, I'm on the healthcare advisory board for Workday, their council, and they've talked about kind of almost like a Siri application, and that will be learning as questions are asked. And I'm really interested to see what that's going to look like. We're not there yet, but the thought that all of our employees, we have about 15,000 employees, if they can actually use their mobile device to answer questions about their, you know, what are their healthcare benefits or anything else related to any of their benefits as examples. I'm really intrigued by that. So we'll see what comes of it.
Thanks for those insights. And our next question here, so are you anticipating the implementation of Workday will allow you to reduce FTE requirements in key areas such as AP or other departments? Spencer, do you want to start us off?
Yeah, I mean, we put together a business plan as part of that, and really this implementation, as much as it's a software implementation for us, it's really you know, a transformational change, and what we talk about here is our target operating model, and that involves many different pieces, including what we call the service delivery model. And we are looking at that, and there, you know, we do believe there's some opportunities just based on how we're structured. It's not as much necessarily about the technology as it's about that change management, that service delivery model work that we're doing. We have a consulting partner that we're working with on this, so it's not really the driver of our project, quite frankly, but we do think that you know, it's something we're looking at.
Rob, you want to add something there?
Sure. We're about 6 months in to from our go live, and we anticipated that we would have a need for less FTEs in finance and HR. What we found is that everyone's doing a different job than they were before. So in finance, we've actually rewritten everyone's job description pretty much, and we're trying to redefine what everyone does and be more thoughtful about what they do. But yes, there's definitely opportunity because Workday creates so many more efficiencies than our previous ERP did.
Brian, if I could just mention one other thing, this is Spencer, that we've thought about, as an example, we've thought about our resources like in finance in 3 buckets. So we have our shared services, which are things like AP, payroll, accounting. We have what we call shared strategic centers, things like planning, analytics, revenue reimbursement. And then we also have a model of finance business partners. And so as much as when we're thinking about FTEs, it may be a reduction in FTEs, but it could also just be a reallocation of our FTEs to more trying to, you know, when we think about shared services, we like to do those services with the least amount of FTEs we can to get the work done accurately. But we may be making investments in other areas that help kind of our decision-making process.
Thanks, guys. And Rob, I'm going to throw this next question your way. Can you speak to any areas of improved collaboration across the organization as a result of your implementation?
Sure. Just the way Workday is built, based on security and business processes, you have to be cognizant of any changes you make there, especially within HR and finance. Any change you make in finance will likely directly impact HR and vice versa. So we found that we've had to collaborate much more across those two areas. Now it happens across all departments in the organization as well, but especially in those two areas, and it will absolutely be that way with supply chain when they go live as well. But you know, we used to not necessarily have weekly meetings with HR, but now we have weekly meetings and talk about any issues that come up related to business processes, security, anything that we can do to optimize things with payroll or AP. So it's definitely, it forces you to collaborate more.
Thanks, Rob. And Spencer, I'm going to throw this next one your way. So who in the organization will have long-term ownership for your ERP solution, and how do you envision continuing to optimize?
Yeah, I mean, we are a year out at this point from that, but we certainly have thought about our service delivery model for IS, finance, supply chain, and HR. And I really would say it's a shared structure. We are going to have a team within IS that will help kind of connect the dots to make sure that we're not building business processes or editing business processes that, you know, have a negative impact to HR or finance or supply chain. So we don't want to do anything in silos. But you know, I certainly think that IS team will be a great foundational group that will connect dots and will bring us together for dialogue. But I do see this as it's not an HR-led or supply chain or finance-led project. It's really going to be a collaborative project across all the areas.
Great, thank you. And so this next question, I'll let you both. Oh, go ahead.
I just wanted to chime in on the on optimization and just the long-term ownership, if I may. At Dayton, we created a Workday Governance Committee. It's headed by our CFO, and sitting on that are leaders from HR, finance, and IT. Our security leads from HR and finance create and lead an agenda for our monthly meetings. We discuss any changes that we need to make related to security or business processes, and we make sure that we have a synced relationship between payroll and HR. We monitor customer service, review stats, and monitor security changes. We propose any changes and any additions of new modules within Workday. And we also create audits and report those back to the committee.
Thanks for those insights. So our next question here, how will you look at this solution differently than your past investments? Rob, we can start with you this time.
Sure. So besides an EMR, an ERP is probably one of the single biggest things you can take on as an organization. So, you know, as Spencer mentioned for CHOP, I think he said that they hadn't done a new ERP since '99. So it's not something you want to do very often. So you want to make sure you do it right. It's obviously highly expensive, and Workday is great because it is highly adaptable, and you can be dynamic with changes as they occur in your organization. So making sure that you pick the right vendor for your organization and implementing that just has a long-term effect on your organization.
Spencer, you want to weigh in?
Yeah, I would agree. I think that I would absolutely agree with Rob. It's a big decision, right? I mean, it's a long-lasting decision. Having a very thoughtful process, I think is critical. One of the things that, and this was started before I was here at CHOP, but they thought about it as with all the pieces, all the components, and we it's interesting when you look at Workday. When we were doing a lot of our reference calls, a lot of our reference calls were, we started with HR, we went to finance, and now we're thinking about supply chain. And where things have evolved, it was our decision that we wanted to do this together instead of pulling out, prioritizing one project, building a bunch of integrations, then doing another project that are throwaway integrations, and then moving on. There's risk in doing it either way, but I have to commend the CHOP team that started before I started here, that they really were thinking about the full continuum of the work, all the different domains, and they engaged with a consulting firm to just even do some preliminary discussions and thought around this. So it's a very big investment, and it's a big investment of dollars, and it's a huge investment in time. That's kind of one recommendation I would have, is that you kind of look at it, if anyone's considering doing this work, that they kind of look at it holistically.
Great. And this next question looks like a great one to end on. So what is one piece of advice you would give to children's hospitals that are planning for the future? Spencer, you want to get us started?
Sure. Plan for the future of their ERP platform. I think I kind of go back to what I was previously stating, is that it's a large investment. So take a step back and really make sure that you're thinking about all of the pieces. Our scope didn't really change in our project. We added one small area into scope, but we didn't have scope creep. And as you're thinking about the reality is that as we looked at a lot of these vendors, they are going to continue to maintain an on-premises system, but all the vendors we talked about are moving to the cloud. So I think it would be prudent to think about that. And where do if you're thinking about the future, where do you want to be? What do you want to accomplish? And kind of looking at that next generation technology, we thought was a good idea at CHOP, and I would recommend that any organization should consider that.
Thanks. Rob, what advice would you offer?
Similar to Spencer, I think an ERP obviously is such a big investment. You want to make sure you get it right the first time. And also on Spencer's previous comments, creating collaboration within your organization is of the utmost importance. As data becomes more and more prevalent, and we have to make more and more decisions in a quicker manner, we need to make sure that we have that data and it's accurate. And having disparate systems just doesn't allow for it. We want to make sure that supply chain, HR, and finance are all working together, and being in the same system is just definitely an advantage. And also, you want to make sure that you're getting value out of that product, and it's advancing. And Workday definitely does that. As mentioned before, supply chain, when both CHOP and Dayton Children's chose to go with Workday, supply chain was not quite ready for implementation, but they worked hard, and a couple of systems are already live, and CHOP and Dayton are both working towards it. So you want a platform that will continue to grow and advance as well.
Thanks for those takeaways. And it looks like that's all the time we have for today. I want to thank Spencer and Rob again for sharing their expertise with us today, and the audience for their attendance and participation. I'd also like to thank Workday for sponsoring this informative discussion. Enjoy the rest of your day, and we look forward to having you join us for future webinars.